Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you about a life-threatening emergency, and it's allergic reactions. But I wanted to talk to you about something that happened to me personally and how I ended up saving a guy's life out in the field one day. Actually, we were at a convenience store at the beach. So, if you're watching this video and someone yourself or someone you know or love is having an allergic reaction, and if they're having trouble breathing, dial 911 immediately and get them to emergency room or to a medical facility as quickly as possible, or get them to a fire department or EMS unit as quickly as possible if you're close to that. Because if you're losing the ability to breathe, you need to jump on that problem immediately and get professional treatment. Now, if you've dialed 911, let me tell you, as quickly as possible, get a dose of Benadryl in the patient, 50 milligrams as quickly as possible in an adult, or give an age and size appropriate dose if it's a child with children's Benadryl. And then also give either famotidine, which is Pepcid AC, or Tagamet, over-the-counter anti-inflammatory, which are drugs that are in the classification of H2 blockers. They're stomach acid secretion medications. Now, the reason we do that combination together is because the Benadryl, or the antihistamine, is blocking the H1 histamine type 1 receptor. Now, if we've got a type 1 receptor, then we probably, and as you would guess, we also have a type 2 histamine receptor. And the type 2 histamine receptor, the H2 receptor, is what controls acid secretion in your stomach. And the drugs that are used for that are the previous drug that's been taken off the market, which was Zantac, is the trade name. Then there's Pepcid AC or famotidine, and then there's Tagamet. Those are the typical H2 blocker medications, but it needs to specifically be an H2 blocker. So if you or a loved one are having an allergic reaction, get a Benadryl or an antihistamine type medication like that in you as quickly as possible at the appropriate dose. But then also take a acid blocking drug, not an antacid like Tums or something like that, but specifically an H2 blocker like famotidine or Pepcid AC or Tagamet, and take that medication immediately, because that's an H2 blocker. And back when I was in medical school, back in the days of dinosaurs, they told us that H1 and H2 receptors were completely unrelated and there was no cross-reactivity. We now know that that's wrong. So if you block the H1 histamine type 1 receptor with an antihistamine such as Benadryl, and at the same time you block the H2 receptors with medications such as famotidine or Pepcid AC or Tagamet, if you do that simultaneously, 1 plus 1 does not equal 2. 1 plus 1 equals 3. They actually work together, and you get a collective improved response to both medications, and it can actually help the patient significantly. But again, if there's any question of airway involvement with what we call an anaphylaxis type severe allergic reaction, dial 911 and get to a healthcare provider, or get EMS or paramedics or ACLS ambulance service to you or the patient as quickly as possible. You don't want to risk delaying treatment when it comes to severe allergic reactions. Now, just a quick story about what happened to me. Some years ago, I was at the beach, and I was at a convenience store, and I just walked out of the store, and a lady pulled up in the car. She jumped out screaming that her boyfriend was having an allergic reaction in the car. So I ran around to his side of the car on the passenger side, and he was literally gasping for air. And I asked, had she dialed 911, and she said that she had, but that the ambulance was off the island, and another ambulance was trying to get onto the island. And we were out at the beach in Savannah, Georgia, at Tybee Island. And in that moment, there, because of bad traffic and the summer and lots of beachgoers, we were caught in a position in that moment where we actually didn't have an ambulance on the island, very briefly. Terrible timing, but that's what happened. So I ran into the convenience store and grabbed Benadryl And in that case, I actually got Zantac, which is not on the market anymore, but it's a type 2 histamine receptor blocker for acid secretion. And I very quickly gave him a large dose of Benadryl, and he was able to get that down, and gave him a large dose of the Zantac H2 blocker stomach acid medication. And interestingly, by the time the ambulance got to the gentleman, he was largely resolved and was able to breathe effectively. And they took him to the hospital anyway for him to get checked out, which was completely appropriate. And but this guy was literally taking his last breaths by the time I got both doses of medication in him. And but fortunately, they worked fast enough. Over the next 10 to 15 minutes, he showed significant improvement, and he actually made it. So not a great situation, but if you find yourself in that situation, and in fact, I carry in my everyday carry first aid kit, I carry Benadryl and famotidine tablets just in case something like that ever happens again. I actually have them on my everyday carry on my person all the time, just a few tablets, but enough to treat a patient should a symptom like that occur. So anyway, I hope you find this little talk on allergic reactions useful. Look forward to talking to you again soon with one of our medical chats. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.